welcome everyone to this space. I'm Emily Wu. I'm the co-president of AAAM, and we welcome you into this space. This is the first event in our series of events that lead up to our AAPI Heritage Month celebration. In May, we wanted to start a little early because we know that there are a lot of events upcoming around the Bay Area in May. But we are so honored to invite Sonny Lê to join us today to start this conversation that we really wanted to have about representation, but not just the representation in terms of cultural representation or individual experiences, but how a representation through numbers, and especially that Sonny is an expert in census data. And some of us actually have worked with him during the 2020 census, and some even before in the previous census. Sonny is going to give us a lot more of his both institutional knowledge and community wisdom on how representation works in the aspect and how that might help us in our community advocacy. So welcome, Sonny.
I'm so glad to be here. Thank you very much for even think of me being a speaker. I usually don't. Even though I worked on 3 different decennial censuses, but I don't usually go around and say I'm a census expert or that I can talk numbers. It's just like I picked up a little bit here, a little bit there over the years. And like Ben has mentioned, I worked with him on refugee resettlement back in the late 70s, early 80s. He started about 6 months before I. So we've been around a little bit. Interesting fact is that my first place I slept was in Novato, actually, at the decommissioned Hamilton Air Base. That air base, when it was decommissioned in the mid 70s, for a couple of years or so, it was used as a transitional holding area for arriving refugees. At that point, in the late 70s, early 80s, refugees from Southeast Asia, primarily Vietnam, Cambodia, and Laos, were arriving as many as 14,000 a week, 14,000 people a week. We all came through Oakland International Airport, and if we couldn't be processed immediately, then we would be bused to Hamilton Air Base to be housed overnight. And I just happened to arrive on Thanksgiving Eve, so nothing was open, and it was a 4-day weekend. So I got to sleep in the 4-star air base for 3 nights until Monday to be processed. So it was my first taste of turkey and other things that people ordinarily in the U.S. eat for Thanksgiving. And I'm sorry, I didn't like the turkey. It was too dry. That was my first turkey, and that would have, I think, that was the first. And I've had turkey 2 more times, and that was it. So I try again and again. No go for this guy. Roasted duck, or no roasted duck. Ham is okay, but no turkey. Anyway, so that was my first exposure to Marin County. I started out working with Ben at the Southeast Asian Settlement Center in San Francisco. And the 70s was very interesting time in the US. It coincided with the Soviet occupation of Afghanistan and the Iran-Contra situation in Central America, as primarily El Salvador, Nicaragua, and Guatemala. And then we also had a situation in Russia itself, when Russian Jews wanted to leave Russia, primarily the Ukraine, and they were allowed to leave as well. And of course, the Bay Area was basically saw an influx of refugees and immigrants. And those seeking asylum, actually, some of them are still living here today, still without status. And primarily, Salvadorans, Nicaraguans, and Guatemalans. They still live in limbo up to today. And so we had an influx of refugees from the Middle East, from Southeast Asia, from West Asia, and then from Central America. And so that the country became a melting pot overnight, even though has always been a melting pot of the US. So that sort of a combination of that, and also the US, you remember that during the 70s, the US saw a lot of social unrest. So we had what we call urban flight. Those people start leaving the urban cores of the city for the suburbs. And that meant only African Americans and Latinos and refugees got stuck in the what we call today inner cities. And so that created an effect that the census began to see a nosedive of people not participating in the census. Distrust of government, the cynicism against the government because of the Vietnam War, and of course also because of the urban police violence against African Americans and Latinos. And then you have refugees coming in that ordinarily don't trust the government, like Vietnamese. We didn't trust the government there, that's why we left. And so, coming in here and the government too darn friendly, we don't know what to make of it. And the same thing with Russian refugees too. And so the census experienced a huge undercount in the 80s and 90s census. And so I just happened to be here in the Census Bureau. I was directing a cultural arts organization in Oakland, and the Census Bureau recruiter came in, looking for somebody to manage the communications campaign. And they found me. And even though I hadn't been taking the census or been counted in the census myself, but the 2000 census was the first time that the US government began to engage communities that don't speak English well, or ethnic minorities. And it was the first time that until the 1990 census, it was all English. In the 90 census, there was a selective areas of the US received a Spanish version. And then this is really amazing that the Census Bureau actually considered this. It ran the census form in different languages in the newspapers. And you would have to cut it out and fill it out and send it in. So if you are a refugee, you're an immigrant, likely that you would never read the Marine Independent Journal or the San Francisco Chronicle or the San Jose Mercury News to have seen the form in the first place, right? In order for people to have seen the census form in Korean, in Vietnamese, in Russian, and in Spanish, they would have to read English newspaper first. And then they have to copy the newspaper and fill it out and send it in. So how many refugees, immigrants first came to the US would know how to do that? None. Copy machine, where do you go? The library, I've never been to the library. How do you ask when you go to the library for help? So that was the extent of government outreach to people who are not white or who are not Black in the US. And thankfully, there was enough people responded to the census in 1990 to indicate that for the first time since 1776, that America woke up and said, oh my God, we have so many people who are not white. And how many years did it take? Hundreds of years, right? And so And also, oh my God, they speak Spanish. Oh my God, they speak Vietnamese. Oh my God, they speak Mandarin. Oh my God, they speak Russian. By the way, the Spanish language was spoken in the US before English language arrived in the US by more than 100 years. And the Chinese were started to be spoken around the same time as the English language. And the Russian language was spoken here prior to English. And so, if anything, these languages are foreign languages. I never refer to non-English languages as foreign language. English language is a foreign language. Think about it. It just arrived here after Spanish, after Russian, about the same time as Chinese, after Filipinos. So to call Chinese or Spanish language foreign, it's a silly idea. So that's not acknowledging the existence of people who have been here all along. And if anybody will object to, that would be American Indians or Native Americans say, hey, you speak foreign language there. And so for me, it says a lot when we ourselves have to stop referring to what we speak as foreign language. And we have to stop seeing ourselves as anything but whatever we claim to be. And part of my work is census work requires a lot of boxes filling out, right? But I refuse to put myself in another box. People look at us like, you Vietnamese, one box. You have Chinese, that's another box. You heterosexual, that's another box. You have certain age, you're another box. You don't speak English well, that's another box. So why would we want to put ourselves in another box? So that's why, try hard not to become the perpetrators of stereotypes and all the things that have been used to exclude us. Before I go any further, I would like, if possible, Emily to play that video clip because that's because the 2020 census was really challenging because of the political situation in the U.S. So the last census, 2010 census, was the most open and accessible census to me. I mean, having worked on 3 different decennial censuses. So this is give a sense of what the 2010 census was trying to do.
On April 1st, 2010, our nation will be counted. Every person, whoever they are, wherever they live. And what we learn will transform what we know about ourselves. The 2010 census, it's a new portrait of America. The 2010 census is an exciting milestone for America. It promises to deliver accurate information about our diverse and growing population. And it's important for the future of every community.
The Asian American community is one of the fastest growing communities in the United States, which means it's particularly important to have an accurate snapshot of where our community is and how large it is.
Census data will be used to allocate over $300 billion in federal funds every year. Communities use the data to plan for their future, like disaster and emergency services, healthcare services, schools, transportation, libraries, senior centers, and more. The 2010 census builds on the success of previous censuses and is the best planned and most well-researched census ever. And innovations, like a new short census form, will help to make it even more successful. The 2010 census, it's easy to complete. Data are always confidential and safeguarded. It's important.
It really is important to have local people involved in the process to help to explain what the census data is about, why it's important to participate, and also to explain that the information will be kept confidential.
We need every leader in every Asian American community to step forward now and to volunteer to take it upon themselves to get the message out that the census is coming and it's important to participate.
The 2010 census. It's easy, it's important, it's safe.
A photograph, a time and place, a picture holds a moment's space, a portrait of hopes and dreams, telling the story of our times. And for now we know that we're changing fast, and for now it's clear that we've left the past. America, let's celebrate. We're proud and we stand tall together. A portrait of us all.
The 2010 census. It's a new portrait of America.
I get goosebumps every time I see these ads. This is another reason why I loved working for the census and I love census data. Unfortunately, America is reminded how diversity is only once every 10 years. It should be reminded that America has always been diverse, and it should be a reminder every day, not just once every 10 years. And the thing about the census to me is it's the most accessible, and it's a voluntary process. There's no other countries that conduct the census like the US. And if America can live up to that kind of ideal, I think we would be in a much better place. Unfortunately, it happens only once every 10 years, and it's a rush, always a rush to get everyone counted. And the thing about the census is that you have to keep in mind is that it can only count you if you want to be counted. So that goes to another thing that as Asian Americans, I want to remind people, or remind myself in particular, that in Chinese, there's a saying is that the quacking ducks get killed, or in Japanese, in Japan, the nail that sticks out get hammered down. But in the US, it's different, right? The squeaky wheel gets the grease. So as Asian Americans, we kind of straddle both. So which one do we subscribe to? And I think mentally, the Japanese and the Vietnamese and then the Chinese version sort of weighed us down sometimes. We know that we need to stick our neck out, but we're always, we're kind of leery. We're not sure when and how. So that's the thing about sticking your neck out, is that you have to know when and how to do it safely. Though not losing face, we assume there's only an Asian thing, but it's not. Everybody fears losing face. So let's not say there's an Asian thing. Stop, because it's not an Asian thing. Everyone fears losing face. Who wants to lose face? Nobody. Doesn't matter where you come from Siberia, Argentina, from Spain. Nobody wants to lose face. So it's not an Asian thing. And so that's the thing about the census, is that when I started working for the census in 2000, I was lucky to have been given a job of representing the Census Bureau, not just myself or my community. And I would like to tell you a story of my first press conference as a spokesperson for the US Census Bureau. And I was convened at the Asian Law Caucus office in San Francisco, hosted by the Asian Law Caucus. So it was myself and the person representing the city, speaking about the census. And the first question came from a Vietnamese media person. He asked me, whether I was hired to represent the Vietnamese community. I said, no, I represent the US Census Bureau. Because if I had to count just the Vietnamese, I can do it in a day, because that's how many Vietnamese media outlets there are. And then again, the same thing, the World Journal reporter asked me if I was hired to work with the Asian media. I said, no, I work for everyone. When I was hired, and it was my first time, somebody asked me to do things that's not Asian. I had a job interview at the San Francisco International Airport, of all places. My boss, my would-be boss, who traveling back from Washington, D.C., and he asked me to meet up with him at the Starbucks at the gate, Alaska Airlines gate. Back in those days, remember, you could walk up to the gate, you have to see your friends, family off. So he asked me to meet him there for a job interview. And I was very confused because I was recruited. I was not looking for that job. They looked for me. And after roundabout, I asked him, so what do you like me to do? Asian media, Bay Area? He said, no, Sonny, we want you to take care of 4.5 states. And we want you to take care of Russian media, Chinese media, Vietnamese media, Spanish language media, all the media outlets, plus communities, cities, and counties and states. And I said yes, but I was not sure if I heard him right. I wasn't sure because it was the first time somebody asked me. Back then, my accent was even heavier than this. I wasn't sure if that's what he wanted me to do. And the fact that a federal government agency needed somebody like me, it was a liberating moment, empowering moment. And also it shows that the limitations a lot of times is ourselves. That I saw myself as a Vietnamese person. I saw myself as a Asian American community activist. I didn't see myself as somebody who could handle white media, black media, brown media, yellow, you name it. So that's the thing that for Marin County, you know what this latest population count is for Marin for Asian Americans? It's 7%. And that's about, what is it? I did a math, and 7%, it comes out to 26,000 people, 26,000 of Asian descent. And because 26 doesn't seem a whole lot, but in a county that has, only 261,000 people, that's quite a few. That's significant. And that's only the people who live there. And that doesn't count the people like Young and like Khoa and some other people traveling there, working there, doing work there, right? So there's a lot more than 20,000 Asians or Asian Americans in Marin County. And another thing I was saying is that the census can only count those who want to be counted. So that means that number is there's an undercount. See, it's unusual, but it happens. A lot of young children being left off the census count by their own parents, their own relatives. It's something about us adults that we don't see little kids as being humans or fully grown adults. And so we don't think of them as an individual to be counted. So we leave them out. And I don't know, you're probably aware of this, but there's about 19,000 Southeast Asians with deportation orders. These are Vietnamese, Vietnamese, Cambodians, and Laotians. These individuals, whatever they did in their youth, they now have an immediate removal order from the US government. That means if the immigration police find them, they get put in jail and deported back to those countries that they never grew up in. They left when they were too young. And the Asians make up about 16% of undocumented residents in the US. And the top undocumented community groups are Chinese, South Asian, or Indian particularly, Korean, Filipino, and Vietnamese. And so you cannot explain, you have to understand that there is an inexhaustible supply of cheap labor working at Korean restaurants, at nail salons, at Chinese restaurants. Where do you think those workers come from? Right? So there's a pipeline of undocumented Asian immigrants supplying the workforce in these cheap labor sectors. And if you are those individuals, you don't want to be counted in the census. For once, you fear exposing yourself to the government and get deported. And also there have been a sizable number of the Chinese, Korean, and Indians who have overstayed their visas. Unlike folk from Mexico and other Central American countries, these people legally flew here. They happen to overstay the visa intentionally and disappear. And these individuals are considered undocumented. They may have come here to visit their family members. They may have come here on a short-term visa to work, and their contract ran out and they decided not to go home. And so if you take a totality of all those individuals, undocumented, those with deportation orders, and a lot of Asian immigrants have young children, families have young children. So if the number is 20,000 residents in Marin County, you can almost double that number for Asians in the county. If you go knock door by door, you're going to get a lot more than 20,000. Since you can knock door by door, so the number is higher than that. And another thing is that in the census, it's self-counting, so it doesn't force you to count yourself. So it's making it really challenging for Asians and Asian Americans. Is that, you know, like if you're from China, they actually literally show up at your door and asking you questions. Back in the olden day in China, the system, they literally counted how many rooms you had in your house, so that they would know if you make money the way you said you make. And in Pakistan, they literally send text people because those individuals know the households very well to count people. And so if you're counted by those individuals, you don't want to tell the truth. And so all those reasons why Asians fall into one of those hard to count populations. And I know that it's, the cities and counties do their best to get all of us counted, but that can only go so far. And that's where, organizations like yours, it's very important in the community. And I would, having worked for the Census Bureau before, that I know that we are stronger when we stand together with other communities. When the undercount, it affects everyone, not just one community or another, because when the federal government sends the money back to Marin County, it doesn't care who you are or whether you're being counted. It's based on the raw number. If you have 260,000 people, it sends money for 260,000 people. And if you're undercounted, that means you shortchange not only yourself, but also your community you're surrounded. And a lot of times we don't think about, like, for example, the potholes in front of your house. That money comes out of the census dollars. The libraries come out of the census dollars. The same thing with the child care center, seniors, elder services, all those things. And another thing that we don't think about is that census data is also used for cancer research. Some years ago, that numbers came out that Asians or Vietnamese have high incidence of cervical cancer, but the federal government didn't know what to do because there was no data. If there's no data, how do you do research? And you know that China, India, and much of Asia right now is seeing a spike in hypertension and diabetes. And it's not just the people there, but the people here too. So that we're not that far from our relatives in Asia. And so you can count on the fact that hypertension is high in the Asian American community as well. But if without the data, we don't know. Asians are the least likely to seek mental health or speak to someone. And I don't have to tell you that depression and other mental conditions afflict our communities in disproportionate number, but we don't seek help. And if we don't seek help, and we're not counting census, and we don't make noise, then there's no data, there's no services, there's no numbers for us to do anything at all. I would like to share the screen about two cornerstone laws that we have in California in the US. That's where how government function and how different agencies decide what to provide services-wise. I'm going to share the screen, okay? So this is the 1964 Civil Rights Act. And if you, you know, the interpretation is that nobody should be discriminated against, including language access, including limited English speaking ability. But I can speak personally, and I think some of you may have the same experience, that until the 80s, that when you go see a doctor or when you have to deal with the government, guess who have to do the translation, the interpretation? It's the kids. Sometimes, I'm not kidding, it's not a joke, it's real, that they actually ask a Chinese waiter to help. At the restaurant, say, do you speak Chinese? Come. I need somebody to translate for me. Even though it's enshrined in this law since 1964, nobody enforced it. And we didn't demand it either. We didn't demand the services. We just silently accepting, oh, this is America. No, our community is too small, so we're not gonna make any noise. So even though our rights are protected by this law right here since 1964, not to mention the Constitution, this and that, just this is the fundamental right to our being here to receiving services. And there's another law in California too, the Dimely Aleatory Bilingual Services Act, 1973. However, cities and counties, agencies, and hospitals routinely shirk this law, this act. I worked as a medical interpreter for over 20 years and beginning working with Vin Lu there at the Southeast Asian Resettlement Center in San Francisco. And I remember my first time going to see a doctor. I was accompanied, or the person who helped translate could barely speak English. He was able to say a few words in English, but he was acting as my translator. And in fact, it's ironically, a few years ago, I acted as his interpreter for his medical visit. And so imagine that means that his English is nothing, that he wasn't capable of interpreting. But nobody said, wait a minute, we need to get a certified, qualified interpreter to interpret for this young man who just arrived from refugee camp and he needed to see a doctor. Nobody said anything. So my point is that I'm going to stop sharing this so that you can get a chance to talk about these two laws. And can you stop it for me, Emily? There you go. So my point is that when we make noise and demanding services and having our rights addressed, it's within the law when we do that. Those laws are enshrined in those two bills, the Civil Rights Act of '64 and the Bilingual Language Act in 1973 in California. And so I leave you with those two, and let's have a discussion about what we can do or how we can help ourselves and other communities, not just only in Marin County, but I know that you have connections to other counties in the Bay Area as well, and to the larger nation. So thank you very much. Let's have a conversation.
So I know of a lot of people who are undocumented, who are very afraid to be counted. So I guess the question that I have is this: how do you or the government, what can they do to get people to trust when there is a census?
The census, until we can change the law, it's enshrined. It's in part of the Constitution, and that was actually the second article in the Constitution that say that in order to apportion the seats in Congress, census has to be conducted every 10 years. And in order to change that law, you have to have a congressional. It has to be Congress, an act of Congress to change that. And at this point, I don't think we can have a unified Congress to change any kind of law on that level. But that shouldn't stop us from doing self-educating ourselves by knowing that this is the foundational part of the nation, that we have a role in getting ourselves and people around us counted. Currently, the state of California is trying to, the governor of California has started an office of civic engagement, trying to keep the momentum from the 2020 census going and trying to engage community groups and organizations in an ongoing basis. The Census Bureau has what is called Census in the School, and it engages the young ones, the little ones, to get them be cognizant of how the US government uses census data. However, the ongoing strife in our country, like racial strife, economic inequities, and social and health inequities, all those things are barriers to a better census count. And also all those barriers create distrust of the government. And so advocating for the census also means advocating for the civil rights of others, not just ourselves. And so that's why it's very important that when we trying to get our community members counted, don't just stop there. Get your Latino workers, get your neighbors, get your gardeners, get your chefs, whoever, the person who makes your tacos or the person who fixes your computers, all those persons, they being counted have a positive impact on you. And so it's not just advocating for the census. You have to advocate for everyday equities as well. That's part of it. You know, Josie, you have two perfect individuals in our area to speak to. That's the Speaker of the House, Nancy Pelosi, and Senator Dan Feinstein, because those two individuals can institute or call for hearing and making a proposing laws to change the census or how census should be conducted. So they are right now, luckily, we have a Congress in Democratic hand. And as long as Nancy Pelosi is still there in charge, you have a very good advocate in her. I suggest you reach out to her office.
What was the problem where you encountered on 2020 census?
The problem with the census is that it's when it changes or the way it's being carried out reflected who's ever in the White House. If the person in the White House didn't believe in the census, then the Census Bureau would have a problem. That's all there is to it. And Congress is attempting to insulate the Census Bureau from politics. And hopefully they're gonna get that done. And the Speaker of the House, Nancy Pelosi, is also involved in that, and Barbara Lee, and some of the people in this area, some of the elected officials from this area have been very strong advocates in trying to protect the Census Bureau from political interference by appointees. And so basically that's what happened. You had a government that didn't believe in the census because the census, when the count goes up, it's usually, that means that more Black and brown people being counted, people like myself and yourself being counted. And there's been stereotype, but there's some truth to it, is that anytime when you have more Black and brown people counted, they tend to vote Democratic. That's the stereotype. It's kind of stuck, the narrative, that they're not counting the Korean Republican and Vietnamese Republican. I guess they forget about those people. And Taiwanese Republican too. So, and South Asian Republican as well, a lot of them. So they forget about those numbers. So they think that only Asians and Latinos and then African American only vote Democratic. And so that's why they didn't want more Black and brown people voted. I mean, counted, that's all.
But wasn't it the 2020 census got really delayed and they didn't count everybody? Wasn't that a problem?
No, it got delayed by the pandemic. So that means that the pandemic, because we couldn't go out knocking on doors. But that shouldn't stop the county from doing redistricting or doing its own thing. So right now, I don't know if, I think it may have been too late already, but usually the redistricting conversations or debates take place during the months of January, February, and March. Those 3 months is when redistricting conversations take place. And that's another thing too, that, you know, again, the census is only one part of it, the civic engagement. We have to be more aware and take part in all the civic engagements as well, including the redistricting. And it's at the county level, so and city level. So that's something easier to work with and you know, to get involved.
I know more recently you've been working with vaccination campaigns.
Right.
And so what have you learned from the 2020 census that you think were important going into
so that's I'm glad you asked me that, Josie. I left one big man in the White House and work for another man in Sacramento now. That's the vaccination campaign. It has the same challenges as the harder count. People don't want to be vaccinated. People don't trust the government. And I can tell you this about two things about Asians' vaccination rates. If you look at the data, the Asians have very high vaccination rate, correct? But it doesn't tell you who. It just say Asian. It doesn't say Vietnamese or Taiwanese or Nepalese or Bhutanese or Burmese. So in addition to getting counted, you have to argue for breakdowns of census data as well. Show that, okay, do Vietnamese have the same vaccination rate as other groups? So that's part of the data. Another thing is that some surveys have come out now. One at Boston University, to be exact. Another at the in the San Luis Obispo County Public Health. That and in Hawaii too. Vietnamese in Hawaii had the second most COVID deaths after Pacific Islanders, second most. And Boston Asians, especially workers in restaurants and nail salons and others, have the highest incidence of infections. So the study in San Luis Obispo of nail salon workers, why they were so highly vaccinated, and basically most Asians wanted to get back to work. And we kept hearing that in order for you to go back to work, you have to be vaccinated. So people were motivated by the ability to earn money, because a lot of Asians, I don't have to remind you that a lot of Asians don't make the same amount of money as others. So in Marin County, an average white person makes $86,000 a year. And average Asians make about $62,000 a year. So you see that it's less. And also a lot of surveys you see about how Asians households have high income. The word is household. It doesn't say individual. And Asian households tend to have more people. If you count household income, then it's not a good number. If household, that means it could be 5 persons. Each person makes $20,000. 5 person makes $100,000. It looks like a lot of money. That household is 100,000. No, that household is poor because each person makes only $20,000. A white household has less people. If they make $100,000, that's a lot of money. So you have to see those things and not to, oh yeah, Asians are better off or make more money. That's not true. And also a lot of Asians, they buy new cars and nice cars based using the collateral is the laundromat, the collateral is the restaurant, the collateral is the nail salon, the collateral is the dry cleaner in order to buy that fancy car. So that means that they didn't buy it outright. They didn't buy it out of pocket the entire amount. So it doesn't make them rich. You know, driving a nice car doesn't make you rich, not necessarily. So all those factors why on papers, Asians have higher vaccination rates. And also, it's funny, it's interestingly in San Luis Obispo, it's so the public health students at Cal Poly actually interview these workers why they were vaccinated. It's that because they wanted to go back to work for one reason. Another reason is that pressure, peer pressure, your friends telling you they have been vaccinated, so they want to be vaccinated. Those two primary reasons why Asians have higher vaccination rates. And I can tell you a personal story about Asians vaccination. So in order for me to go back to Vietnam, I had to be fully vaccinated and I had to get a PCR test in order to get on the plane. And I had to get another test in order to come back. On the plane, my fellow passengers, mostly Vietnamese, they had no idea what to do with the mask. They took the mask off one day, 1 minute, and they put the mask on the next minute. And then in Vietnam, nearly 99% of, like, it's 92% of the population are fully vaccinated, adults. For my own experience, I asked my family if they understood anything. No, they don't understand anything. They still don't. They got vaccinated because the government told them so. It's not because they understood science. It's not because they knew it was good for them. They did it because they were told to do so. And the Asians over here got vaccinated because of peer pressure, because of the need to go back to work. It's not that we believe in science any more than a white person, a black person. It's not that we are smarter than a black person or a white person. No, if you buy into all that, then you know, I guess you perpetuate in those stereotypes. So yeah, that's it. That's why Asians have higher vaccination rate. And until we have a breakdown of different ethnic groups, then we don't know exactly what the real number is. We don't. So the data, the base data of many things in the US is called based on the American Community Survey. Because in the American Community Surveys, which is a rolling surveys on a monthly basis, it asks questions about mental health. It asks questions about what languages are spoken at home. It asks questions about how long you drive to work every day. So those questions are fundamental to everyday life. And so the vaccination is based on the ACS 2019 American Community Survey data, not the 2020 census. That's how we started out. And so that data is projected data, estimated data. So it's not real, like 1, 2, 3, 4, 5 people number. So the reason the data don't show up, it's not because the data not collected. Just like, for example, the language access. In order for the most cities and counties set a benchmark, for Alameda County, for example, it has to be at least 1,000 individuals not speaking fluent English in order to provide language access services. So that means that a county sees the Asian community too small. And it's like, well, it's too small. We don't have the resources. The data is there. The data is collected. It has to be pulled out and calculated. The data exists, but it has to be tabulated. So it's a political will. So if you and I demand, for example, Marin County to pull out data for Vietnamese, and you go in front of the board of supervisors demanding that, trust me, it will happen. Until somebody asks for it, see? Then it won't happen. So if you remember that when you filled out many forms, right, it asks for your ethnicities and age and all that stuff. So people do collect, government agencies do collect data. They just have to be pulled out, put together.
I signed up for the Census Bureau emails, and they actually are very user friendly. I mean, they do webinars, all kinds of webinars, about how to find the answer to the question that you have across all these populations.
Individuals, then it's not that easy. It seems easy, but it's not that easy. So as a collective, as a group, you can ask the Census Bureau to give you a training, so a workshop, a data workshop. So some data specialists will come to you and sit down with you, the group, and walk you through the process of tabulating data for now for specific communities and groups. I recommend you to request that data workshop with the Census
Sounds
Bureau.
interesting. So,
yeah.
And you also mentioned the American Community Survey. How does that differ from the current population survey? And how does that differ from the census?
The census is a head count. Okay, it's called the decennial census. So every 10 years, it's 1, 2, 3. So you knock on door and you count for the people behind that door. That's the decennial census. American Community Survey is about 250,000 people a month. And it varies, it goes to different cities and different groups and locations to get a good sampling. That is called a survey. That's why it's called survey. That means an estimate. So it takes a sampling pool of 50,000 people. And that's how it comes up with, this many people travel this long and this far. It's based on averages, numbers. The population surveys is larger surveys. And it's not a rolling basis, and it's not every 10 years. It's every few years, and so it's not. Again, those things called snapshots. The decennial census it's called snapshot in time. So it's taken only once every 10 years. And the same thing with the population survey. But the American Community Surveys, that has been practiced long enough that is nearly perfect in terms of the study of statistics of populations, that the scientists have come up ways to tabulate the data that is nearly perfect. That means nearly mirror the reality. So there has been advocacy for using that as the means to count people, because it's more timely and it's more, it asks more questions, a lot more questions. Including if you have indoor appointment question. And so it's better. That's how when you walk into a Target store or you walk into Macy's store, you see certain things that, wait a minute, when did they have jasmine rice here? Oh my God, they have kimchi in this place. It's based on those data.
How are they going to count, people who, like population shifting, for example, California, a lot of people during the pandemic moving out of California through different state, or there's a different area in California. It's much cheaper. People, move there, people don't have to work. How do they account those new populations?
Yeah, so that was one of the problems during the pandemic, is that a lot of the tech workers went home, and a lot of students left home. Nobody, was on campus, so you couldn't count people around the campus area. This is shocking, no, but actually, this U.S. Postal Service that maintains a record. When you move, you have to sign up for change of address. And in fact, there was a report out of San Francisco, and it's down like nearly like exact number of people moving in and moving out, because you have to change your utilities bill, you have to change your mail-in address, all those things. Trust me, this government, the US, is incredible at keeping information and data. So forget about saying stay anonymous. You can't stay anonymous in the US.
So people aren't trusting of the government, so therefore they don't want to complete, say the census. But what about people who falsify the census for whatever reasons, okay? I mean, is there a way that the government can monitor or track, to say that this is accurate or not? So what I'm getting at is that there's fears on the side of the people who are completing it. And is it justified because the government has a way to track and to verify if you accurately completed the census?
This is just like the voter fraud. Census fraud is very low. Voter fraud, despite what you read here in the news, it's very low. And census fraud, the thing is that if you want to commit census fraud, it takes a lot of work, and you don't gain anything in return. And so why do you do it? So for voter fraud, you get somebody elected. For census fraud, you don't get anybody elected. You don't get any money for yourself. You must have to get tens of thousands of people to commit fraud with you in order to make a difference in your city and county. And if you have to enlist that many people, then you're exposed already. So census fraud doesn't gain anybody. So, but we have, the Census Bureau reports the number of people who claim to be blue people or Area 51 residents or Klingons and Romulans. These are fictional characters. They do put it on there. And they do Dr. Spock, and they put it down, like Charlie Brown, they name. And they would, put the fictitious Charlie Brown's house place. So they do. And the Census Bureau reports that kind of thing for fun, that people actually have fun, with the census. How the Census Bureau knows, actually, it looks your name, so, and then the households ask you if you're related to person B, related to person A or not. Name, age, birth dates. If there's too many coincidences, then it's the same person. So that's how they X out the coincidences. It could be two persons with the same names or the same birth dates, but not the same order, middle name, or the same relations, or the same address. And so it's the reading of the census, scanning the census form is amazing. The Census Bureau have been doing this in 1790. The Census Bureau is actually a consultant to the UN and many other countries on how to take census. And so having seen the Census Bureau from the inside out, I say that nobody beats the Census Bureau when it comes to counting people.
I work for a nonprofit, and we were trying to get our folks who are mostly non-dominant culture, non-white, to get vaccinated and to participate in the census. And one thing that I found, and this is not to say that everybody's doing this, but I happened to talk to an elderly couple, Vietnamese. So maybe you can answer this for me. And they told me they would not get vaccinated because of all these things they were hearing from other Vietnamese people in Vietnamese.
Right.
It's like the Proud Boys talking to each other, the January 6 people talking. How does the census or vaccination people, do they know that they have to, I use the word infiltrate, that's a bad word.
Okay.
But how do you influence those people and give them correct information?
So this is unfortunate for our country at the time. I don't know, you're probably aware of this, is that China and Russia were the first to say they had the vaccines. Remember? They said they had the vaccines.
Right.
And all the Chinese vaccines, all but one, has been approved or endorsed by the WHO. And the US still doesn't recognize Chinese vaccines. None of the Russian vaccines have been approved by WHO. And even the Russian people don't want to take their own vaccines. They don't trust their own vaccines. Same thing with the Chinese. They don't trust Chinese vaccine. Chinese people don't trust Chinese vaccine. Think about it. And so those two countries have good reason to try and undermine the US vaccination campaign. And so there has been a very strong disinformation campaign online, on YouTube, on WeChat, on Taobao, on what is it, on Zing for the Vietnamese, on Naver for Korean, many platforms trying to muddle the message, trying to confuse people.
Mm-hmm.
And on YouTube, and in fact, quite a few Vietnamese are ardent supporters of the last president, true followers. And so they have YouTube channels where they talk nonsense day in and day out, and to make money. And so that's confused people. So because of those channels, because if you don't consume news in English, you don't watch CNN, you don't watch ABC, NBC, or KTVU, then that's all you know. And you keep hearing the same thing over and over. So it's not just they don't want to get vaccinated, it's like they've been confused. They don't know what to think anymore. They don't know if it's true anymore. During the census, we couldn't prove whether it was started by China or not. But there was a lot of Chinese immigrants who said that if you're not US citizen yet, don't take the census. You are still Chinese, you take Chinese census, you don't take American census. And so some Chinese immigrants didn't know they could take American census. And we have to explain that you are here in the US, you take American census, you're not in China anymore. So it took that kind of convincing. As for the vaccination campaign, the US and the state, we monitor, but we can only do so much. So we rely on organizations like Asian Health Services, Northeast Medical Services, Self-Help for Elderly, and other entities, including the JACL. They also help with the vaccination effort. And so we call those trusted messengers. We call you a trusted messenger, Beverly. You're the individual. See, I mean, we're not here to argue with people that they get bad information. We can't. If we argue with people, we lose. So what we do is that we show them, here's the data, here's the messaging in Vietnamese, here's in Mandarin, here's in Cantonese, here's Korean. Read it for yourself and you make up your mind. And the same thing with my relatives in Vietnam. They said at the beginning, they only had the Chinese and Russian vaccines. They asked me, brother, should we take this? Nobody wants the Chinese vaccine. We waited for the American one, a British vaccine, the AstraZeneca or Pfizer. Actually, it's ironically, Vietnam has been saved by AstraZeneca, Pfizer, Moderna. If it had not been for the British, the Americans, the Vietnamese still in a hurting place right now. They would be in really bad place.
Good.
So, but the Chinese and the Russian vaccine, they took them and said, thank you very much. We're going to put it over here. And they still sitting there, millions of shots. Nobody wants a Chinese vaccine. So that's it. That's all you can do, Beverly. I mean, we can only show them the information. It's the same goes, we can take a horse to the water, but you cannot make it drink. America is messy. I mean, that's what we say. But I love this place. That's why we get to do this kind of work, right? We have this forum. We can talk about these issues only in America. And so, Josie, I've learned a lot from my elders. I've learned a lot from people who have gone before me. So I came into this job following that I didn't lose in others. I just refugees landed here, didn't know what to do, had to find my way, and luckily I've been taken in by a lot of people who've done some kind of work that I do. And again, it's because of organizations like this necessary. And these are, to me, it's like the pillars, the foundation of the communities. And this is how communities built through this kind of effort. People coming together. I know that we have a lot of differences, but we have a lot of things in common as well. And Marine seems like an outpost, but it's not, because travel back and forth and people moving around. And so yes, I would not have been able to get here without people like you around all these years. I'm currently working on the vaccination campaign for the state of California. It's called Vaccinate ALL 58. And by the way, you should apply for the $5,000 to help with events. We have a mini grant that you can apply for. You don't have to have programming. Basically, you said you're going to use this to support the county events, and you can use it for the month of May or June. Say you're going to come up with some events, and the vaccination campaign has a lot of materials that you can use. You can order from us, so you don't have to print anything literal. Just simply put them out, and you pay for the cost. You can use your pay for a band, for a dance group, for a Taiko drumming group, for a dance group, for a I don't know. You can come up with creative ways to bring people together and pay for it. Churches qualify, parents groups, youth groups, schools, libraries, they will qualify. So by all means, apply for it. It's a
Do you
very
have to
easy
report
process.
back how you use the money, Sonny?
It's in the application. It's a small amount, so we don't ask for a lot of
documentation.
No.
We can use it.
Yeah. If you belong to churches, please, your church qualifies. So.
All right.
Okay.
Thank you.
Emily, you will share the link with you. Okay.
Yes, I will.
Okay.
All right. Thank you.
Thank you very much.
Thank
Have
you.
a good night.